I'm Ben Mayo. I'm one of the fourth-year residents here at University of Illinois Chicago Orthopedic Residency. I'm here with Dr. Mark Hutchinson, who's our sports medicine attending here. He actually went to medical school here at UIC before going to his residency at Michigan State in Kalamazoo, and then his sports fellowship at Kentucky before he returned here to be an attending, and has been here ever since. He is the head team physician at UIC for the athletic department. He's also been a team physician for Team USA at the 2016 Olympics in Brazil, and will be going to Tokyo next year for the rescheduled 2020 Olympics. He's also been team physician for Chicago Sky at the WNBA, as well as some other Team USA at the different games they compete in. When it comes to sports, he's pretty much seen it all, and he's happy to share that knowledge with us. He's one of the favorite attendings to work with for the residents, and has been voted attending teacher of the year many times. Also, he has a orthopedic physical examination series on YouTube that has now close to 7.4 million views. So Dr. Hutchinson, you've been here at UIC a long time, since you finished fellowship. What brought you back to UIC, and then what has kept you here?
Ben, that's a great question. My wife is a Southside Chicago girl. I loved my medical school training here, so I love Chicago in the first place, but in all honesty, a happy wife is a happy life, and so that brought me back. But it's also a great city. I mean, it's one of the great cities of the world. There's movie theaters and nightlife and sports teams to keep things going, and it's a centerpiece of orthopedics. So the American Academy of Orthopedic Surgeons is headquartered here, all of which makes it a great place to train.
Great. And then, obviously I talked about the residents love working with you. What's some of the things that you enjoy about working with residents here?
Well, I think probably the greatest thing is it's a selfish benefit, and that is it keeps me young. There is no way for me to keep practicing orthopedics without having you guys challenge me to say, hey, here's the newest article. What do you think about that? What do you think about that? That means I have to read it all. By the same token, I get to challenge all of the residents. I get to help them develop and to become the best orthopedic surgeon and the best sports medicine surgeon they can be. And watching them develop is just a great benefit of life.
And do you have a particular case that you really enjoy taking residents through?
Sure, I certainly love all the cases that I do, but taking residents through, I love to take the junior residents through a basic arthroscopy, whether it's knees or shoulders, learning the motor skills. And in fact, I helped found the Foundation in Arthroscopy course for the Arthroscopy Association of North America, and we bring some of those skill sets and learning sets here to the residents at UIC. But perhaps my favorite is to take a more senior resident through an ACL. And so like when you're on rotation for 2 months, watching them improve from basic arthroscopy to then doing the case start to finish is a great thing to see.
One of the kind of unique aspects of the residency program here at UIC is we get a pretty robust sports coverage and sports experience with you here at UIC, and we cover North Shore. We work with Dr. Coe and some of the sports attendings down at Christ as well. What do you feel are the strengths of the sports experience here, and the things you think kind of differentiate us?
Sure. Many years ago, when I came here, we actually created as part of the program that the residents had to cover some of the UIC sports teams. The gift of that, even if you want to go into some other subspecialty, is when you get out and practice, you are going to be the local orthopod who says, hey, will you be the team physician for the soccer team, the high school, or things like that. So those are a skill set we learn here, personally, I love it, and so I love to be on the sideline with the residents and talking about the game and talking about sports injuries.
Great. And along those similar lines, just as the residency program as a whole, what do you view as the strength, and how does that help prepare our residents as they go into fellowship and eventual careers?
Yeah, that's perhaps the most important question for the residents or the medical students who are applying here is will this place train me for my next step? And the next step for 99% is a fellowship. This program is amazing to me. It's surprised me over the years in terms of the quality of fellowships that these residents attain when they graduate. And I've tried to assess why that is. And I'm convinced it's because when you get done at UIC, you actually can jump in and be a general orthopedic surgeon right away. But on top of that, you make good clinical decisions. We have good clinical experience at UIC. In the clinics, you're learning to make the diagnosis, make the decision, and perform the procedures. So all the fellowship directors know there's a reputation for UIC, that you are a sound orthopedic surgeon that makes good clinical decisions, that they can trust their patients to your care in fellowship. And that sets you up for fellowship and sets you up for as a good orthopedic surgeon through the rest of your life.
Well, thank you very much for taking the time with us. All the residents really appreciate the effort you put in and taking the time to answer questions here.
My pleasure. Good luck on the interview trail.